All right, I know how it goes. Things start off strong, but a few minutes in, you lose firmness and suddenly you feel embarrassed, frustrated, or even hopeless. If that sounds familiar, this video is for you. I'm here to tell you that not only is this incredibly common, but it's also something you can absolutely fix. Today, I'm breaking down the 7 most common reasons men lose their erection during sex, and more importantly, exactly what you can do to stop it from happening. Hi, I'm Dr. Nancy, urology and men's health expert here on Health Desires. I help men improve performance, protect prostate health, and feel confident and energized at any age. Make sure you stick around until the end, because I'll be sharing evidence-based solutions that can truly transform your sexual confidence and performance. To fix the problem, you first need to understand how an erection actually works, and this is where things get fascinating from a urological standpoint. It all begins with your parasympathetic nervous system, the rest and digest branch of your autonomic nervous system. When you're aroused, your brain sends signals through the pelvic nerves, triggering the release of nitric oxide into the smooth muscle cells lining the arteries of the penis. Nitric oxide is the key messenger molecule that tells those arteries to relax and widen, allowing blood to rapidly flow into the erectile chambers, known as the corpora cavernosa. Research published in the Journal of Sexual Medicine shows that men with higher nitric oxide levels experience significantly better erectile function and faster response times. Simply put, the more nitric oxide you have, the easier and more efficient this process becomes. At the same time blood is flowing in, the small venous valves responsible for blood outflow must close off properly. This traps blood inside the penis and creates the pressure needed to maintain a firm erection. It's a delicate coordination of smooth muscle relaxation, healthy arterial inflow, and effective venous occlusion all working together. Here's the clinical reality I see every day in my practice. As men age, the body's ability to produce nitric oxide from the endothelial lining of blood vessels declines significantly. Studies show nitric oxide production can drop by as much as 50% between the ages of 40 and 70. This is one of the main reasons erections weaken over time. The arteries simply aren't receiving the same strong relax and open signal they once did. But here's the encouraging part. Just because nitric oxide production has declined doesn't mean it can't be improved. In my experience as a urologist specializing in men's sexual health, erectile function can almost always be optimized. I take an evidence-based approach by identifying root causes and addressing them systematically, because improvement is possible at any age. For example, clinical research shows that natural compounds such as French maritime pine bark extract can significantly enhance nitric oxide production and help reverse chronic venous insufficiency. This condition occurs when venous valves become leaky, allowing blood to escape from the penis too quickly during intercourse. A study published in the Journal of Cardiovascular Pharmacology found that this extract improved endothelial function and increased nitric oxide availability, resulting in reduced symptoms of venous insufficiency. The result is better blood retention and stronger, longer-lasting erections. When you combine targeted supplementation with smart lifestyle changes, the improvement can be dramatic. Erectile function ultimately comes down to vascular health, nerve signaling, and hormonal balance working together in harmony. Now that you understand the physiology, you can see how anything that disrupts this balance, whether it's poor circulation, nerve interference, or mental distraction, can cause an erection to fade. The good news is that in most cases, control can be regained. Let's break down the 7 most common reasons men lose their erection during sex, based on clinical research and years of real-world patient experience. Reason number 1. Gravity is working against you. Position matters more than most men realize. Lying flat on your back with your partner on top allows gravity to pull blood away from the penis instead of helping it stay trapped inside. This is especially problematic if you have any degree of venous leakage, which becomes more common with age or after penile trauma. Reason number 2. Psychological factors. Your brain is your most powerful sexual organ. Studies in the International Journal of Impotence Research show that psychological factors contribute to up to 60% of erectile dysfunction cases, particularly in younger men. Performance worries activate the sympathetic nervous system, which directly shuts down erection maintenance. Reason number 3. Reduced penile sensitivity with aging. Research published in BJU International shows penile sensitivity can decrease by up to 30% between ages 40 and 70. Diabetes, cardiovascular disease, and reduced blood vessel elasticity all contribute to this decline. Reason number 4. Insufficient arousal or mental engagement. Being physically present but mentally distracted weakens the brain-to-penis signaling required to sustain an erection. Stress, depression, relationship tension, and environmental distractions all play a role. Reason number 5. Performance anxiety becoming a self-fulfilling cycle. Once erection loss happens, fear of repetition triggers the fight or flight response, which directly blocks parasympathetic erection signals. Reason number 6. Poor cardiovascular health. Erections are a vascular event. Conditions like high blood pressure, diabetes, high cholesterol, and arterial plaque directly impair penile blood flow. Studies show erectile dysfunction often precedes cardiovascular disease by several years. Reason number 7. Hormonal imbalances, especially low testosterone. Testosterone supports libido, sensitivity, and erectile quality. Levels decline about 1% per year after age 30, affecting both desire and performance. Now let's talk solutions. Empty your bladder before sex. A full bladder compresses pelvic nerves and interferes with erection signaling. Use gravity-friendly positions such as standing or kneeling. Prioritize extended foreplay to enhance stimulation and reduce pressure. Avoid alcohol before sex. Even moderate drinking can reduce erectile function by 25%. Space ejaculation strategically to allow hormonal and neurological recovery. Consider a constriction ring to help trap blood if venous leakage is an issue. Implement a comprehensive vascular support plan with exercise, nutrition, and targeted supplements. Address sensitivity by optimizing testosterone, improving circulation, and using controlled vibratory stimulation when appropriate. One final note. The supplement industry is filled with overhyped, underdosed products. I only recommend a small number of clinically supported options I trust for performance, prostate health, and natural testosterone support. These include L-citrulline from watermelon extract, saw palmetto, zinc, and ashwagandha. You'll find trusted links in the pinned comment and description. From my clinical experience, men who address vascular, hormonal, neurological, and psychological factors together see the most consistent and lasting results. Erectile dysfunction is rarely caused by just one issue, but it is highly treatable. Your sexual health is a powerful indicator of overall health. When you take care of it, everything else improves too. If you're struggling, you're not alone, and there's absolutely nothing to be embarrassed about. With the right approach, confidence and performance can return at any stage of life. Take care of yourself. You deserve to feel strong, confident, and satisfied in your sexual health for years to come.